Welcome back at 7:13. January is Glaucoma Awareness Month. More than 3 million people in the United States have glaucoma, and it's the leading cause of irreversible blindness. But early detection can help prevent vision loss. Joining us this morning is Dr. Brent Wallis from People's Health to tell us about the symptoms, risk factors, and why it's important to remember to make those eye doctor appointments. Dr. Wallis, good morning. Thanks for being with us.
Thanks for having me.
So let's back up a little bit and explain to people what glaucoma is exactly.
Sure. So, glaucoma really develops whenever there's damage to the optic nerve. And it's usually related to an increase in pressure in the eye. And the optic nerve is really critical because it sends all those visual signals to your brain so that you can interpret what you're seeing.
And what are some of the symptoms of glaucoma? What can people look out for, I guess, between those eye doctor's appointments they should be going to each year? What should you be on the lookout for?
Yeah, the hard part about glaucoma is often there are really no symptoms at all, and it progresses gradually over a long period of time, and it also affects your peripheral vision, so not your central vision. So it can be real insidious, and that's why it's so important to get checked by a doctor. There are occasionally some symptoms of certain types of glaucoma, things like eye pain or headaches or spotty vision. If you have some of those, you need to be seen by a doctor right away.
Dr. Wallis, are there any risk factors or potential groups of the population that are more susceptible to glaucoma?
Yeah, absolutely. Age and family history come into play like a lot of diseases. Over 40, the incidence begins to rise, so that's usually when we start screening. And then over 60, it becomes a lot more prevalent. And then if you have a relative that has glaucoma, you're about 4 to 9 times more likely to develop glaucoma as well. And then the other things that I always consider is, have you had a previous eye injury? That can lead to problems down the road. And then certain medications, especially blood pressure medicines, can lead to glaucoma as well.
Now, Dr. Wallis, I mentioned at the top of our conversation here that there are about 3 million people in the U.S. with this eye disease, and it can cause blindness. It's one of the leading causes of irreversible blindness, but treatment options are available. What are the treatment options that people can look into if this is something that they find out they have?
Sure, yeah, thank goodness there are treatment options. Unfortunately, we can't reverse the damage once it's happened, but we can slow it and hopefully prevent the blindness. So we use a variety of techniques. A lot of times it's prescription eye drops, sometimes oral medications, but we can also use that in combination with either laser therapy or surgery, and that can really help to sustain and prevent future vision loss.
And of course, I mentioned also at the top of the conversation that you're with People's Health. So can people find out more information about glaucoma, symptoms and signs and treatments through you guys?
Yeah, absolutely. We've got all this information and a lot more on our website. So come see us at peopleshealth.com, or visit us on Facebook, Twitter, or Instagram.
All right. Well, Dr. Wallis, as always, we appreciate your time. Thanks so much.
Thanks, Kelsey. Have a great weekend.